Hi guys, my name is Kiran Saishri and I am a final year student from Viluppuram Medical College. So I have just done videos just to help you out people for easy studying during exams. So these are just the topics which I read in my everyday. I'm just doing this because I'm just getting bored in my quarantine. So I just thought to do videos and just upload it. So today's topic is about obstetrics. The topic is perinatal mortality. So before going into the topic detail, you should know what is the definition of perinatal mortality. So perinatal mortality means the number of stillbirth and death in first weeks of life per thousand live births. This perinatal mortality, it may commence as 22 completed weeks. So 22 completed weeks means 154 days. So this perinatal mortality includes the late fetal and the early neonatal period. So before going into the topic detail, you should know some terms. So the first term is what is fetal death rate. It is also called as stillbirth rate. So fetal death rate is divided into two. Fetal death rate and late fetal death rate. That is the early fetal death rate and the late fetal death rate. So early fetal death rate is the number of fetal death that is occurring during the year, which is divided by the number of live births in the same year, which is expressed per 1000 live births. So this early fetal death rate should be more or equal to 20 weeks of gestation. So the next we are going to talk about the late fetal death rate. So this late fetal death rate, the number of fetal death of gestation during the year by sum of live births in the same year, which is expressed in 1000 live births. So this late fetal death rate is of more or less than 28 weeks of gestation. So suppose if we don't know the weeks of gestation, we can also derive it by the weight of the child. So the formula for this is fetal death weighting over 1000 grams at birth by total live birth plus fetal death weighting 1000 grams or more at birth. Okay, hope I guess you understood. You can also check it in obstetric books, page number 419. So it is explained in detail because it's a formula, so you people may not understand. So the next, we have to know about the neonatal rate. So I just said you right, perinatal period is the period between the late fetal and early neonatal. So neonatal, we should also know the definition of what is neonatal mortality rate. So neonatal mortality rate is defined as it is the number of neonatals during a year divided by number of live births in the same year expressed per 1000 live births. So as we these are the definitions of these words. So what makes the child to die? So you must know the causes. So the first we would go about the stillbirth causes. Like I just said, is stillbirth rate. So stillbirth causes we are just going to see. So these might be because of fetal causes intrauterine growth restrictions, any syndromes, any defects, anomalies. Next is placental causes like any disorder, hypertensive disorders, abruption or disorder of any pregnancies. Next is the maternal causes, which is due to diabetes, hypertension, or any disorders or any diseases or anything that she had before or during the pregnancy. So that is called as maternal disorders. So now these are all the causes of stillbirth. So next term is neonatal. As I said, what is neonatal mortality rate? So we should also know the causes. For neonatal death, the causes are it might be due to prematurity, any infections, any hypoxic insult, or any malformation, congenital malformations. These are the major causes. The other causes might be due to poverty or gestational age, like highly premature also may cause this. Birth weight due to any birth weight disorders or multiple pregnancies might also cause the death of the neonate. So now let's go into proper topic proper. Okay, I have just said you what is perinatal mortality rate. So we should also know what are the causes for this perinatal mortality rate. So the main causes are divided into antenatal causes, intranatal causes, postnatal causes, and unknown causes. So these are divided into four causes. So antenatal causes, any maternal diseases, anatomical defect during development, congenital anomalies, any infections, RH incompatibility. Antenatal causes might be injury, asphyxia, prolonged or obstructed labor. Postnatal causes, it is due to prematurity, birth weight, or congenital anomalies, low birth weight, etc. Then unknown causes are like mainly due to poor status, poverty, or lack of any literacy, lack of autonomy, or childbirth, like early marriage. These all, like, those people don't know anything about this pregnancy, and also without taking care of themselves, the child dies. So the next heading we are going to talk is perinatal hypoxia. So hypoxia means decreasing in the oxygen. So perinatal means it's all about the child. Okay. So what is perinatal hypoxia? I would just define it. It is a result of interference with the transport of oxygen from the maternal blood to the fetal blood in the placenta, or it may be due to obstruction. So because of that, the oxygen from maternal to fetal is less, so it causes perinatal hypoxia. So what are the causes for this? It is due to any obstruction during pregnancy, hypertension or any regular disease, or due to any abnormal long labor during any stage of trimester. Next, premature separation of the placenta due to any drugs, depressing of the respiratory center, placental changes that due to occurs in post maturity, which leads to hypoxia. So these are the main causes for perinatal hypoxia. So the next heading we are going to talk is about birth injury. So, like, birth injury means what? It's the trauma which causes death to the child. So there are many reasons behind this. It might be due to intracranial injury or due to any hemorrhage during labor that might cause intracranially any like injury it may cause, and hemorrhage may also cause. Then premature fetus, if it is a premature fetus, it's not able to bear. So when it comes out during the delivery, it causes damage to its body. Any congestion or edema of the brain, injury to the spine. So these all are the causes for the birth injury. So the next heading we are going to see about fetal malformations. So fetal malformations means defects which is taking place during in the child during the delivery. It might be due to any medical, surgical, or cosmetic significance. So there are many risk factors for this. Mainly congenital malformation is the main. So the causes of this are, one is unknown. The other one, it might be due to any single gene disorder, chromosomal abnormalities, environmental or maternal medical conditions like infections or any drugs, radiation, hypothermia. These abnormalities are present which are associated with the stillbirth. So the abnormalities, these congenital abnormalities which are associated with stillbirth are like trisomy 18, 13 and 21, Down syndrome, or Klinefelter syndrome. These all you would have heard. So it's all associated with that. Sex chromosome aneuploidy, unbalanced translocation during gene process. Translocation may be unbalanced. So these were all associated with abnormality associated with stillbirth. So this is all whole topic related to the perinatal mortality, and the book which I use is Mudaliar and Menon. I have just studied a glance, and I have given you a glance about the topic today. Hope you all had this session very useful. Thank you, and let's meet tomorrow with another good topic.